Good morning, friends. Welcome back to my YouTube channel class by Dr. Srinidhi Kumar Acharya. Please don't forget to and also comment. Also, this playlist, I covered most of the topics in a very systematic order in a given. And coming back to the topic, my friends, we were discussing about muscular dystrophy. We have seen different facets of muscular dystrophy. So today onwards, we will see some of the important disease-wise aspects of dystrophy so that our knowledge will be very clear. Now, what are the basic criteria to name a particular given condition as muscular dystrophy? We have seen the neuropathies, we have seen the myopathies, congenital myopathies, and many other aspects we already covered. Now, the basic criteria for to say anything as muscular dystrophy is the following. We know that muscular dystrophies are progressive inherited skeletal muscle disorders. Note the point, skeletal muscle disorders. They are inherited, they are progressive, they are chronic, and they result in muscle degeneration and loss of strength. What is the ultimate pathology? Ultimate pathology is muscle degeneration. So why this degeneration is taking place? It is a hereditary disease and progressive disease. And the muscle degeneration, at the end, it leads to the loss of strength, which is manifested in the form of muscle weakness to start with. So basic criteria for the muscular dystrophy is number one, they should be the pure disorders of the muscle. Number two, they should be hereditary in nature. They should be hereditary in nature. They should be progressive in nature. And there should be degeneration and destruction starts at one point of age. At one particular point of age, the degeneration starts and it is progressive, and ultimately it leads to a chronic disorder with so much of disabilities. Now, this is actually the basic criteria for muscular dystrophy. It may be in muscular dystrophy. The progression may vary, like Baker's, Duchenne's, then Emery-Dreifuss, or limb girdle, or myotonic dystrophies. Okay, so these are basic criteria. Now, muscular dystrophies are classified in different ways. One of the most famous classification is Erb's classification. Erb's classification. Okay, so this is done. Number one is childhood muscular dystrophy. Erb's classification is basically divided into two types. Number one is childhood muscular dystrophy, and another one is adulthood muscular dystrophies. When you look into the childhood muscular dystrophies, again they are classified into pseudomuscular dystrophies, that is, muscular dystrophies with pseudo hypertrophy, and muscular dystrophies with atrophy. Again, note that childhood muscular dystrophies are again divided into two types. Number one is childhood muscular dystrophies with pseudo hypertrophy present, as in case of BMD, etc. Another is childhood muscular dystrophies with atrophy. Okay, maybe spinal muscular type, etc., or Emery-Dreifuss. So where atrophy is more prominent rather than pseudo hypertrophy. Second classification is adult muscular dystrophy. Adult muscular dystrophies are again classified into two types. Number one is adult muscular dystrophy with facial muscle involvement, number one. And number two is adult muscular dystrophy without facial muscle involvement. So these two classifications are based on Erb's classification. Okay. So there is another classification of muscular dystrophy is done, that is called as Natras and Walton's classification. Natras and Walton's classification. So on what basis this classification was done? X-linked recessive, autosomal dominant, unclassified, and latest classification. So this is the classification of muscular dystrophy according to Walton's classification. So he says that X-linked recessive disorders. Yes, X-linked recessive disorders. The most common is DMDs, BMDs, etc. Okay. Apart from that, even Emery-Dreifuss also. So they are also actually X-linked recessive. It is autosomal recessive. Which one? Emery-Dreifuss. Whereas DMD and BMD are X-linked recessives. Anyway, it is a recessive disorder. So therefore, this classification. Okay. So X-linked recessive classification. Second one is autosomal dominant. In the autosomal dominant type, we have got two important disorders. One is myotonic dystrophy, but more than that, facioscapular humoral form. There is a small spelling mistake. Humoral form. Scapuloperoneal form. Okay, these are actually autosomal dominant type of disorders. Okay. Another classification is unclassified. Unclassified, we have got limb girdle type. So they're actually not comes under anyone. So therefore, it is considered under unclassified. Similarly, the last one is latent classification. Okay, so these are the two important things. Now, to be more precise, in the classification, first one is in the one classification, first one is X-linked recessive. So X-linked recessive is definitely DMDs. Then DMD is considered as a severe form, whereas BMD is considered as a benign form. Okay, and benign with early contraction or contractures that can be seen in the case of ambulatory diffuse muscular dystrophy or scapulohumeral muscular dystrophies. Similarly, already we have discussed autosomal dominant type, facioscapulohumeral, scapuloperoneal. If you look at the late onset, again ocular, oculoperoneal, facial, etc. See, therefore, the 10 patterns of muscular involvement, muscle weakness is very important, as we discussed in the previous classes. Autosomal recessive, if you want, yes, limb girdle to some extent, because there are so many varieties are there. The collagen dystrophy is etc. Important type of the muscular dystrophies. So this is one important classification. Okay, this is about and this is proper. Thank you very much.